Hi, everybody, and thank you for joining Canceling COVID. Welcome on this wet Friday. We're headed into the weekend with some wet weather, but we're going to make it a great day all the same. And of course, I appreciate you taking the time to stop by and join us. This is your safe space for reliable, relevant, and resourceful COVID 19 information. We want to say thank you to one of our sponsors, Mecklenburg County Public Health. That's mecnc.gov, mecnc.gov. And get this, if you have any questions, 980-314-9400, 980-314-9400. They are there and are willing to assist you on any questions or concerns that you may have. I encourage you, reach out to Mecklenburg County Public Health or some of the trusted resources, not just take someone's word for it or what may be on the internet. In addition to that, thank you to Groundwater Solutions, Dr. Tracia Black, another one that supports this platform out and about in the community working really hard. Well, some great news. It looks like we're making progress for the first time since the spring. Yay! We need like a huge round of applause. The number of COVID cases, well, they've dropped in every zip code in Mecklenburg County. And that's thanks to the hard work from our public officials as well as you. And that leads us to one of the questions of the day that we want to talk about. For those of you hopping on, I see you hopping on, and good afternoon to you. But the question is, are you confident that we're headed in the right direction this time with COVID and all the safety protocols? I know there's been so much back and forth and so much conversation and so much division and so much that's being said, but sounds like finally we are making progress in a great direction, and looks like the right message is finally getting across. So again, drop your notes in the chat. I'd love to hear your comments, hear what you think. I know we thought we had turned a corner before, and I think we did. Just people just kind of got too comfortable and forgot about all the safety protocols. And what's really important is that we want to try to enjoy our time here, and it may just require some sacrifices on our behalf. So, speaking of that, I mentioned Mecklenburg County Public Health. I'm so grateful that they've worked really hard and utilized every platform to try to get the word out, which is one of the reasons why we see the progress that's being made. So, my guest is Deputy Health Director of Mecklenburg County Health Department. I'm talking about Dr. Raynard Washington. He is not a stranger to the show, and I'm so honored that he's able to join us today. I know we were dealing with some issues as far as logging on, simply because we're in a technology age where adjustments have to be made. And so sometimes it creates a little bit of additional work when we're trying to hop on. As we're waiting to try to get that on, I was looking and seeing some additional information really showing that even the hospitalizations are starting to drop around the country as well. So every little bit, is a positive sign, and every little bit helps as we are trying to stay encouraged, especially heading into the holiday season, because I've said over and over, and many of you have shared the same concern. Who wants to do a drive-by for Thanksgiving? Not again, certainly not. And hopefully we won't be in that position. But while we're waiting for our Dr. Washington, a new warning for vaccinated people and some of the headlines that have been released. Two studies published today show that COVID-19 immunity drops 2 months after receiving both dosages of the Pfizer vaccine. And why is that important? That's important to know because now you may not have the antibodies, what's needed to fight off the virus. And of course, that means the protection against severe disease, hospitalization, and death that still remains strong. But that's why the booster shots are so critical. That's why the message is out about now. If you've gotten a vaccine, whichever one that may be, you need to go ahead and get the booster shot. Once your category, I guess, is approved. That last check, I know it was for those that had some underlying health conditions, our elders, kind of like it was before when we first started out. And then you'll see more people open to this. So again, a study, two of them are saying that your immunity kind of drops 2 months after you have gotten the vaccine and gotten the doses, that is a little tongue twister on my behalf. However, the protection against the virus still remains for hospitalization, severe disease, and death. And there's Dr. Washington. I don't have to do much more talking. He's the expert that can explain all that. So, Dr. Washington, good afternoon. I know you're working on your cell phone. We ran into a firewall right there at the beginning. I see you smiling, but what a way. You're just coming back from
Good
vacation
afternoon.
and
I
you
am
have to
so
dive
sorry.
right back in.
The platform is now
That's
blocked on
okay.
the.
Well, it happens, and that's okay. We'll have to get more credibility with the county, and hopefully they'll go ahead and let you
Yes,
get
ma'am.
into us.
Yep.
Yeah. Well, I know. Well, what's going
Can
on? There's
you?
a slight delay, so I just want to go. I'll go ahead and get the questions to you, so hopefully we can get this information so important to our viewers and our listeners. So, the drop in COVID cases, they're a little slight but steady. What would be your comment on that?
Well, I think we're certainly encouraged to see that there's a decline in the number of cases and hospitals also going down, and so that's certainly encouraging. With any spread of infections, that tends to happen at some point. We hit a peak and we start to come down. Now we're just really hopeful that we continue to ride this wave downward and really get the level of transmission in our community down. I think we're headed in the right direction. But certainly we have a way still to go. Our cases are still elevated. We're still in the what we call the red zone as it relates to the level of community spread. So we still not well don't let our guards down,
Right.
but certainly we are encouraged to see some progress.
There's got to be a little bit of concern though when you see this good news. You're like, we put it out there, people will start getting too comfortable again, and we may end up going in the wrong direction. Surely that thought crossed your mind.
Of course, yeah, we certainly know that this time of year is already of concern because the weather changes. It's a rainy day outside today, and so people
Yeah.
start to go inside, they start to gather inside. And so we're continuing to push the message to folks. One, if you're indoors with folks, wear a mask. You don't want to be in crowded settings. Continue to do what you can to protect yourself and your family. Obviously, as you'll probably hear me say as much as I can on this call, get vaccinated and certainly wear a mask and wash your hands as much as possible. We know people go inside. There are a number of holidays on the horizon. Halloween's
Right.
coming up. Thanksgiving's right after that. Christmas is after that. And we know what happened last year. We had one of our largest surges that we've had in this community transpired right after the Thanksgiving holiday and then got much worse after Christmas and New Year's.
So, Dr. Washington, though, the progress that we are seeing, kudos to you all for your help and all of the hard work you all have put in with the public health system, getting the word out. But also, does that mean that we're finally getting a hold on the Delta variant?
I think so. I mean, the variant. What's happening here is very similar to what happened in other countries that were experiencing this variant prior to us, and so we've learned a little bit from them. It tends to surge really exponentially, and then it starts to drop off. And so we're hopeful that we're again on the downswing here and have had our shake of Delta. But again, it's still here, it's still spreading. And so we still got to stay vigilant with those things that help us keep it from spreading.
So we're hearing the term twindemic that's now being thrown around. I guess the concern about people getting COVID and the flu. Are you guys now starting a campaign, or what's being done to now encourage people to get both vaccines at the same time? Because I've been hearing a lot of people that are concerned that's just too much at one time. So how do you respond to that?
Yeah, so we've always got multiple pandemics at the same time. So it's all we always feel that way in public health. But certainly we are starting our flu campaign full force. We started our flu vaccines that are available to both children and to low-income adults, even at the health department location. So you can call us for an appointment. We're starting our marketing efforts. The vaccines have been released. They're being shipped in smaller quantities, and so we don't have a full sort of arsenal of flu shots yet, but we are starting to roll those out and are particularly encouraging children, obviously older adults, and folks who are immunocompromised to make sure they get in line first to get their flu shots as quickly as possible. But everybody, I'll be getting mine later on next week, and I think we're encouraging folks to make sure you go ahead and get that. And if you haven't got your COVID shot, when you go get your flu shot, you can get them both at the same time.
And just to repeat, that is not a problem to do them both at the same time, correct?
No, ma'am, you can get both at the same time.
All right. So for all my aunties and elders and everyone listening, just so you'll know that. Now let's talk about the boosters. You kind of talked already about the vaccine that's being approved for our younger population, and of course, the flu shot. How's everything going with the booster shot? Like, we're seeing a pretty good response to it. And I want to acknowledge, I see everyone hopping on. Thank you so much. Actually, here's a quick question, too, before we move to that, Dr. Washington. Tonya Harden says, does the flu shot hurt more than the COVID vaccine?
No, it doesn't hurt any more than the COVID vaccine. They both have similar complication profiles. Commonly, people, you have a little bit of soreness at the injection site. So right in your arm, you might be a little bit sore. I also got my third shot of my COVID vaccine, and that was pretty mild. I had a little bit of soreness at the arm for probably a day, and then that went away. Typically, the same symptoms are true with the flu shot. Sometimes you may have some flu-like symptoms, which is really just your body, your immune system responding to the vaccine. But typically the level of complications or side effects are fairly similar for both.
Yeah, thank you. I just wanted to throw that in. She goes, no, she says it did hurt her. So everyone has a different reaction, though. I'm certain of that. So that's one of the things. And thank you to Frederick Love and Erica Simonton Beatty. Good afternoon, to both of you for hopping on as well. Now on to the booster shot. You said you've gotten yours. How is that going as far as from the county's perspective, as far as getting the word out and getting people in to get their booster shots?
Yeah, so of course it's been a little bit challenging because it all happened really quickly and there's a little confusion. It only applies to certain groups and
Yeah,
only certain vaccines. So we've been really working to make sure we communicate with our residents as quickly and as much as possible of who should be able to go get a flu shot. A third dose right now. We
right.
are seeing a steady uptick in folks coming in to get their third doses. A lot of our seniors are getting in here as quickly as possible. It's great to see them back in the clinics every day and smiling
Yeah.
and ready to roll their sleeve up. But we are seeing folks come in, particularly folks who are older, who have underlying health conditions, who are immunocompromised in any way, or people who work in the front lines. If you work in a grocery store, if you work in healthcare and public health, in any high risk setting, if you're a police officer, we're encouraging those folks that received the Pfizer shot 6 months ago or longer to come on in and get a third dose of Pfizer. For folks who are immunocompromised, though, if they got Pfizer or Moderna, they should come on back and get a third dose as well if it's been again that 6 to 8 month period. So you want to make sure that you check the health department website. If you get confused or have a question or just you're like this doesn't make sense to me, just call our hotline. Our staff are there from 8:30 to 5 every day and willing to walk you through your situation. They can look up your vaccine record and give you guidance on whether or not it's time for you to come back in to get a third dose. I will go ahead and say all three of our health department locations, the southeast location and the northwest location on Beatty's Ford Road, you can just walk in during the daytime and get a shot there. Hours are posted on our website, mecknc.gov/COVID-19.
Good information. So Tonya Harden. She said that the flu shot did hurt her more. I misquoted. It hurted her more than COVID vaccine, and it knocked her on her behind. But she does want to. She has a question. If you have a health issue and it hasn't been 6 months since you got the vaccine, is it still okay, or is she approved to come in and get the booster shot?
No, not yet. So you want to wait until the 6 months from when you got your second dose, and so you want to wait
Okay.
at least 6 months from that period, and then you can come back in and get the second dose. You want to let your immune system have a chance to sort of use what you got the first two times, and then that boost will at the 6 month mark will help you have a longer term response.
And that's a great, that's why this is great. People are able to ask questions, and just like you've been able to provide professional, reliable information, it's so good that you guys have the hotline available as well. I believe the number was up. That's where people can go for questions. That's where they can go to register for appointments. But you also noted that walk-ins are available at two of the locations. So again, you all are doing a great job of making everything accessible. Now, does the booster shot, this has come up too. If I've got Pfizer originally for my vaccine, do I have to get the Pfizer booster, or can I get the Moderna?
Yeah, so right now it's recommended that you get the same shot that you got the first time. And so only individuals in those groups I described earlier, so folks who are older, are immunocompromised, 65 or older, immunocompromised, have underlying health conditions, whether it be hypertension, cancer, being overweight or obese, any individuals with those qualifications are eligible to be able to come in. If you got Pfizer, Right now, the FDA is reviewing data that was submitted by Moderna, and there's data
Mhm.
coming in from Johnson and Johnson for third doses for those as well for a broader group of people. And so we expect that those third doses for people who got Moderna and Pfizer will be available later on this year once the data have been reviewed and recommendations have been made. The only exception to that is if you are immunocompromised. So if you have a condition that makes your immune system weaker, if you're on therapy, for example, chemotherapy, or if you have an autoimmune condition, if you have HIV disease, for example, any of those conditions, and you also got Moderna, then you can also come on in now if it's been 6 months from the time you got your shot to get a booster.
All right, Dr. Raynard Washington, thank you for hanging in there with us. I know how of a perfectionist you are, and we'll work through it. I just appreciate you working through it. I can feel you over there because I'm the same way about, wanting everything to be in order. But you are so valuable in providing the information that's needed. So as we wrap things up, any closing thoughts for you? And even our question of the day of what we're talking about is, of course, you already kind of answered that as far as we're making progress, kind of turning the corner, and you feel like we are. Hopefully, as long as we stay diligent in
Yeah.
exercising our safety protocols. So, any closing thoughts as we wrap things up with you?
No, thank you, and thank everybody for listening. Please make sure you tell a friend, encourage your relatives, your young people in your life to get vaccinated. We've got a lot of young people that are sick, that are really sick, who haven't gotten vaccinated, who kind of thought, I didn't really need it because I'm young and healthy. And we really want to make sure we encourage young folks, people who are pregnant, because we're seeing more and more of those.
All right. Dr. Raynard Washington, he was hanging in there. There we go. Thank you again. Thank you for again hanging in there with us and working through this. He had to make some last minute adjustments because he was unable to hop on from his office. But Dr. Washington, people love the information you're providing. Jacqueline Hill says thanks for the information. Erica Simonton Beatty, great information. Tanya Harden, great question. Frederick Love, again, good afternoon, everyone. And here's an opportunity. I need you guys to chime in, share your thoughts on the progress that we're making. The numbers have dropped in all the counties, all the zip codes in Mecklenburg County, that is, and even nationally, the hospitalizations are starting to drop. So the question that we're asking, do you think we've turned the corner? We got to hold on this thing once and for all, and possibly just maybe we may be coming out of this pandemic? Are you confident we're headed in the right direction with COVID safety protocols? Dr. Washington pointed out, of course, we're heading into the colder months, and so more people are going to be inside. I'm sure you're seeing some of the basketball games, the football games where we're all upon each other, although they are outside, but more and more people are gathering and not as spaced out. So drop your comments. Also, do me a favor and share. That's the way we are able to get the information out to everyone, is if you hit the share button. And I see some of you are pretty committed to doing that. And I want to say thank you to that as well. One of the updates I also wanted to share was Pfizer has formally asked the FDA for emergency use approval for a COVID vaccine for children as young as 5. So as they continue to develop, and science is pretty incredible, isn't it? Just working really hard so that we can at least try to enjoy some type of normalcy. We've gotten so far away from it now. And, we talk about still some of the habits that we picked up, especially washing our hands, using the hand sanitizer, being more cautious, and even wearing our mask. That would be the silver lining out of everything that's come out of what we've been dealing with so far. So Tanya Harden, her comment to our question, she says she doesn't think we've turned the corner. The cold months will prove it. And that's what a lot of people are afraid of, Tanya. Thank you for that comment. As we head into the colder months and more inside gatherings, the truth will come out because, as Dr. Washington, he did point out, we still have quite a few people, young people, that have not gotten vaccinated. So let's just keep working at it and see how things go. He did remind me, though, remind me of some of the elders that I know. They're going to need to go back and get those booster shots. They've been vaccinated, but haven't said anything about getting the boosters yet. One additional headline: the White House plans to buy $1 billion worth of at home COVID tests to help ease the shortages. And I heard that story and I thought, wow, $1 billion. That's a whole lot of money. So I hope that these companies are also going to invest. That's right, I said it. Invest some of this money back into the community because obviously, if you've got that type of commitment from the government, that's a check that's been written, $1 billion. Hopefully, some of that money will go back into the community and educate those who need the information and also help some of the communities that have been hit so badly during this pandemic. Tonya Harden just added another comment saying people don't want to wear masks inside, especially with people that they think they're safe. And she's absolutely right. And I don't know how you work around it, especially you talking Thanksgiving and inside eating. People certainly are going to take their mask off and more than likely forget to put it back on. So we'll see how that works. I agree, education is key. Now let's hop on to our second guest. I want to talk about some help that's on the way for Mecklenburg County homeowners. It's the Homes Grant and it could save you up to $340 a year. So, folks, there is a lot of funding out there, and we just really want you to help us get the word out because that's one of the challenges, just getting the information. So, $340 a year, you know, we're in a season where all of this is helpful. So, I want to bring on our next guest. It's Carlo Battle, and she may have been having some challenges as well. I hear a little bit of feedback. But what the heck, you know, it's Friday. We're going to keep going with this conversation. I know she was trying to hop on with her phone. But Miss Battle, are you able to hear me?
Yes, I'm here. How are you, Tonya?
I'm doing fantastic. Thank you for taking the time to join us.
Thank you for having me.
So, kind of talk about the HOMES program. I know it's an acronym for helping out Mecklenburg's homeowners with economic support. So, kind of talk about it a little bit. What's the purpose?
Right. As you stated, Tonya, yes, the HOMES program is helping out Mecklenburg homeowners with economic support. And the program is really about helping qualified residents with grant assistance, mainly geared towards reducing the financial burden that's sometimes associated with home ownership. The grant amounts may equal up to 25% of the taxpayer's last tax bill, not to exceed that $340 that you spoke about.
So, what is the goal here? What are you guys trying to accomplish? And is there an ideal number of people that you would like to assist?
Oh, yes. So the goal here is to make sure that we're supporting the community. You know, the Board of County Commissioners recognizes that affordable housing can be scarce. And that the cost of retaining your residence and your home sometimes hasn't been aligned with income growth, right? And so we're hoping that this grant program will help to relieve that burden, like I stated, that's sometimes associated with home ownership.
So let's talk about the application process. Is it long, drawn out, difficult to apply? And what is the deadline?
It is a one-page application.
Woohoo!
Yay.
Because all
the
this funding, you got to go through all these hoops, seems like. So I get it. And I do get accountability as well. So pardon me for
Yes,
interrupting you on.
yes. We are keeping it simple. It's a one-page application. Just want to share that you must be a Mecklenburg County resident. You must be a Mecklenburg County homeowner. There are some eligibility requirements and considerations associated with the program. We would like residents to view our website, to email us, to call us, even come by our department for more information, and just to get more information about those eligibility requirements and considerations. But again, you must be a homeowner in Mecklenburg County. The application process actually started July 1st.
Oh, wow.
And the deadline is fast approaching. The deadline is October 31st.
So are you able to speak on how many you've helped so far and what is your target? Like how many you hope to get helped before the deadline?
We hope to exhaust all of the funds.
Okay.
The funds were allocated by the Mecklenburg County Board of County Commissioners, and we hope to exhaust all the funds. The applications are received on a first come, first served basis. We still have funds left So we just want to encourage the community to go to the website, determine if you think that you meet the qualifications. Again, reach out to us if you have any questions. We can help you complete the application. We can answer any questions that you have. But our overall goal is to exhaust all of the funds that we have. And I'll say that we do have funding left.
So can I, Ms. Battle, and I don't know if it's Mr. or
Yes.
Mrs., can you even comment on a percentage so far of how many people? I'm not sure if you're able to give us that information.
We don't have the percentage count right now, Tonya, but I can say again that we do have lots of funds left.
Okay.
And we only have about, what, 3 weeks or so before the deadline.
So I received the information, of course, being in the pipeline with the news releases and everything. And this is a question that has come up quite often. So it's not just for this program, but Tanya Harden is asking, how are you all marketing the program? How have you gotten the word out about this?
Great question. So we are kind of boots on the ground. We've been working with a great marketing company.
Mm-hmm.
We have participated in town hall meetings.
Okay.
We are out in the community working with our faith-based organizations.
Okay.
We have yard signs at some of our departments. We're utilizing Facebook Live. We're utilizing social media. We're out in the community distributing flyers, and we're using word of mouth. Word of mouth goes a long way.
It does. It does. But Charlotte is so large now and
It is.
everybody's kind of disconnected in so many ways. I have to keep reminding my mom of that. It's like, it's just a little different now because you just aren't always in touch with people because, you're not in the workplace. People are just returning to sanctuary. So it's a little bit of an adjustment for sure. So tell us,
Yes.
what does success look like? I think you already kind of summarized that. Is success meaning just using up all the funds?
No, success
Okay.
is actually having the opportunity to help the community.
Okay.
That's success, no matter how many applications we get and whether we exhaust all the funds. It's totally about helping the community. We do want to exhaust all the funds,
All right.
but just being there to help the community. We're living in trying times right now. This is
Right.
a great program. Again, it's there to help alleviate some of the financial burden associated with home ownership. So for us, that's the win-win, just being able to help in some form or fashion.
So is this funding though? It was allotted by the Mecklenburg County Board of County Commissioners. This isn't a part of the funding though that was provided from the American Rescue Plan, or is it?
No, ma'am.
Okay.
The funds for the homes program was actually allocated by the Board of County Commissioners and our county manager, Dina Diario.
Okay, well, great stuff, and thank you
Yes.
guys. Kudos to you. We appreciate this program and to our county commissioners for looking out in that manner and recognizing. But I think we all are so much aware of the affordable housing crisis, not just in our community, but as a country, it's all around our country. And so, trying to keep homeowners in their homes certainly makes a whole lot of sense. As we wrap things up, is there anything else you would like to share? There was a question about the website. And of course, our producer has put it up, mecnc.gov/4homes, mecnc.gov/4homes. Is there anything else you would like to share?
Yes, I would just like to reiterate that this program is here to help the community. We encourage all who feel that they may qualify to apply. There's still funding left. And just a friendly reminder that the program ends October 31st. Residents may come by the Mecklenburg County Community Resource Center located at 3205 Freedom Drive, Suite 1000, if they need applications or if they have questions or need that face-to-face assistance.
Good stuff. Thank you so
Thank
much.
you.
Hopefully, we'll have you back and we'll get to see your beautiful face. Thank you for
Thank
joining.
you.
All right. Have a great weekend. All right. .gov/4homes. There I am again. One other thing just to share with you guys as we continue, or we're starting to close out. We were right at the 30-minute mark. I could use your help to support the fight against breast cancer. We know that October is Breast Cancer Awareness Month, as well as Domestic Violence Awareness Month. If you would head over to Dillard's at North Lake and just try on a bra, do a bra fitting. It will support my nonprofit if you just say Tanya sent you in. The lovely ladies over there are just amazing. I believe her name is Carmen and Rob. They've been sending me the information. I've got the flyer here. I don't know if you can see it. Fit for the Cure. That's the name of it. So head over to Dillard's again at North Lake and say Tonya sent me, and it helps to support my 501c3. I'll see you on Sunday. Of course, I'll be listening for you. Sounds of Inspiration kicks off at 7 a.m., 103.3 and 100.5 FM. And in addition to that, I've been telling you or sharing with you, I'm not trying to tell you anything, but just sharing. We're going to kind of make some changes, some adjustments, and start rewarding you for hopping on and for supporting the program. So thank you for your loyalty. Thank you for sharing the show today. Thank you all for always hopping on and providing feedback and questions and making us feel like we're certainly providing great information to you. I know it's wet here in the city, so make sure you, if you get out, stay dry, be safe. We tend to see a lot of problems on the roads when we have a lot of water around. But I want to say again, yeah, Dillard's at North Lake for breast cancer awareness. It's called Fit for the Cure. If you walk in and just try on a bra, they will support my 501c3. And again, hopefully you can see this. I'll continue to uplift it as we continue through the month of October. Have a great weekend, everyone. Thank you so much for tuning in. I can't say thank you enough for your support. And of course, be safe as we continue to work together. Our partners, Mecklenburg County Public Health, mecnc.gov for any questions you have, and Groundwater Solutions, Dr. Tracia Black, and all the great work that they are doing. We're just so grateful for their support as well. Have a great weekend, everyone. And of course, together, we plan to cancel COVID. Take care.